it, Heavenly Father. Thank you for everything that you've done in our lives since morning and everything that you continue to do as we begin this training and this meeting. We pray, Father, that you go ahead of us. May we be able, Lord, to learn what, Father, you plan for us to learn today. I pray this, believing and trusting in your holy name. Amen.
Thank you very much, Adelaide. So again, let me take this opportunity to welcome all of us into this training. As we begin, we still expect that a few or a good number of our colleagues are still yet to join. So kindly let's mobilize them. Sorry, something went wrong. I don't know what happened, but I hope you can hear me. Otieno, confirm you can hear me.
Yes, Songok, we can hear you. Thank you.
Sorry, I think I got dropped at some point. Right. So so like I said, we'll pick up from where we left, and today we will again be able to do a quick demo. Just first and foremost, take you through some few slides, and then take you through a quick demo on how we can use the solutions to track our patient movement across our facilities. So this is where we'll be able to discuss issues around the ART directory, and this is very, very critical. That doesn't mean that whatever we've covered is not very critical, because I think most of the questions that people have been asking around is how will the data be exchanged, or information be exchanged between between EMR, the receiving facility, and the referring facility. Diana, your hand is up. I don't know that.
Yes, Songok, I was looking at the turnout is we are very few. I don't know if we should give people a few minutes to mobilize the other members so that they can join. Probably we didn't post in all the WhatsApp groups so that people can join before we start.
Okay, all right. So how much time do you think we could give ourselves, Diana?
Maybe 10 minutes, probably.
Okay. Meanwhile, can I then allow Dr. Madiba to just make a few remarks? Then we can allow him to join the other meeting. Is that okay? Your guidance?
That's fine.
Okay, so Dr. Madiba will be using my laptop, just like I had mentioned. I'm seated with him, so we'll be able to make a few remarks. Then once the other colleagues will have joined, probably I'll again just do a bit of an introduction to our session today. But let me just allow Madiba to just make his remarks. Karibu sana, Daktari.
Yeah, thank you so much, Songok, and good afternoon to all of us. I'm happy we are back today as a continuation of what we had early this week on Tuesday. I'm happy that we are continuing on well with this series of training when it comes to the various very good updates that we have in the EMRs. As I said on Tuesday, definitely we are moving towards patient-centric approaches in terms of looking at how we care for our patients. And we have to think of ways in which that can happen even through the systems that we have. And I'm happy every now and then we are coming up with even better ways of serving that particular client at a personal level. and really having a way of even following them up, of course, from whatever we had on Tuesday, and even what we are having today in terms of even referrals and all that. So I don't want to say much because I know we don't have time. There's a lot to learn. I welcome all of us to this particular training call, and I'm hoping that we are going to learn as much as we can. And even as we do this, kindly, when we have these trainings, make sure from your counties, from your sub-counties, from even your facilities, you bring in as many people as possible so that all of us can actually be at the same level when it comes to applying some of the aspects of training that you're having in this course, because it's actually important to us. With that, thank you so much, Songok, back to you.
All right. Thank you very much, Dr. Amadima. So, like Dana had suggested, so I'm thinking we can give ourselves a few minutes. I can see we are at 107. Then we can begin at 220 or 225, depending on the numbers that we will have. So let's reach out to our other colleagues. Let's mobilize so that, like I always say, this is the easiest way for us to reach out to a wider audience. And yeah, so let's begin at 220 or 225 thereabout. Thank you. We should be able to demonstrate clearly how to track our patient movement across facilities. And this is the time that we'll be discussing around the ART directory and how the link up will be done in as far as patient movement is concerned from one facility to the other. We should also be able to illustrate data exchange process between the ART directory through what we are calling OpenHIM, that is Health Information Mediator, which is an interoperability layer that would receive and receive information from different information systems, and the system, and it should also be able to coordinate the interactions between the various systems, the various solutions. And again, the beauty with the OpenHIM is that it allows transformation of incoming messages, and this is basically the exchange of messages between facilities. So we will be able to do very quick demos on the same, and then finally we should showcase on the specific areas within the dashboard that would enable us to be able to keep track and manage our patient information as our clients keep moving from one facility to the other. So I think Dr. Amadiva has already made a few remarks. Probably maybe I'll allow the CASCO chair to give us some remarks when we come to the end of our meeting, and also look out for any representative from the CHRI caucus or the chair if available. Then we will begin as usual with a bit of an introduction, a slide deck. Then we will go to the demo. So Otieno will be able to take us through the slide, just to keep us updated on exactly what we will cover or what we'll be talking about when we go to the demonstration bit. Then Victor Were will be able to take us through then the demonstration bit. Kevin Lanyo will then take us through an introductory part of the OpenHIM, sorry, that is Health Information Mediator. And he'll be able to take us through the finer details of the functionalities within that particular IL. And then finally, we will close up with the plenary. So I'm requesting Otieno to start the slide deck. Once you're done with the introduction, kindly welcome Victor. Victor, once you're done, you can hand it over to Kevin. Then after that, I can step in to moderate the plenary session, just in case to respond to any questions. So meanwhile, let's use the chat in case there are any questions during our presentations or our demonstrations. Kindly make use of the chat, ask any questions that you may be having. We may not really allow everyone to introduce himself or herself because of the numbers and the time. So kindly note that before you join the call, we had requested that you register yourself, but that doesn't stop you from also registering yourself on the chat. That is also allowed. And as usual, we will be able to share the recording of this particular session in our YouTube channels. Right, so having said that, allow me then to stop sharing my screen. Then welcome Bernard Otieno to take us through the first session. One announcement: kindly let's keep our videos off. Sometimes it's up the bundles of some of our colleagues when we keep our videos on. So let's try as much as we can to keep them off in the process of our presentations and our training. Thank you very much. Over to you, Otieno.
All right, thank you very much, Songo. Please confirm if my screen is visible on your end.
Yes, your screen is visible and I can also hear you loud and clear. Kindly proceed.
Yeah, thank you very much, Songo, and thanks everyone for finding time again to join us today, being the third training in our series of virtual trainings. So the theme that has been running through since we started has been about patient retention and how we are able to monitor patient appointment keeping patterns through different applications, through different platforms. We've talked about, we've seen how we are able to do this through Ushauri. We've seen last Tuesday how we were able to ensure retention through Kenya EMR, where we were able to look at different reports and the different features that exist in Kenya EMR that would help us ensure that we keep patients in care. So today, just going on with that theme, we are going to now focus on how we can be able to track patient movement across facilities using the existing system, which is the ART directory, which now is, because of the extended functionalities, we are now calling it the ART directory and referral system, because it also, as you'll be able to see, it also supports referral functionalities. So I would just go straight to what we are going to see today. So we are going to talk briefly about the ART directory and the referral system. We are going to look at some of the use cases that it has and the services it supports, including the value proposition for the facility, for programs, as well as looking at the integration bit with the OpenHIM information mediator, which we'll talk briefly about. And lastly, we'll be looking at some of the requirements that you need, if at all you have not started using it. What would you need to really start using this particular application? So first, I would like us to first look at the existing problem. So what are some of the problems that the ART directory comes into to resolve? So one, there is no centralized directory, ART directory, that is transparent across various facilities, where these facilities are able to refer in real time, or they are able to reference, so that they're able to get information about this particular patient or about their ART information. So especially this affects patients, it affects facilities when a patient walks in, when they don't know much about that patient, they don't know where else to reference, and maybe the patient doesn't have full disclosure on their information. So then that becomes a problem. So that is one problem that is being resolved by the ART directory. Another one is for the patients that are transferring in, it is a bit difficult for the receiving facility to know where this patient is coming from, which facility are they coming from, okay? So with the ART directory, the receiving facility is able to just, using the SMS, they're able to get all the information about this patient and the original facility where they're coming from, so that we can have that continuity of care without a lot of gaps. And also there is that aspect of tracking the patient movement across different facilities, as we'll be able to see, where a facility is able to tell in real time where this particular patient is now that they missed their appointment or they failed to honor the appointment. Where did they go? Or even if they go, did they arrive at that facility? Did they get enrolled in that next facility? So that exchange of such information has been missing. Then there have been gaps on, especially for the patients that, the walk-in patients, the transit patients who may be walking to pick drugs because of some reason. They are away from their mother facility. It has been difficult for the mother facility to really validate the information about the drug pickup, because the patient will be like, I missed my appointment, I didn't come because I went for some funeral and then I picked drugs on the other side. Getting that information was not very easy unless maybe a facility makes a call and all. But now with this particular application, that problem has been resolved, as we are going to see as we move on. So brief information about the ART directory. So this is a mobile and a web-based directory that facilitates facilities to query the information around the facility and also the ART information about a particular patient who is coming in for transfer or who is on transit, so that they are able to know much about this patient as well as their facility of origin. Also, it leverages on the SMS technology through a USSD code, where they can now the facility can send a short code and then get information about these patients, including the contact details of the facility, as well as the ART information. And also through SMS, now a facility can receive notification about the patient visiting a different facility, as well as also completing the client transfer loop And in this case, in completing the loop, what we mean here is that if a facility transfer out a patient, they need to know whether this patient is has arrived on the other side. So if they're able to get information in real time that this patient has arrived, then they're able to update their records to ensure that that transfer is complete and the patient is continuing with care in a different facility. So directory and referral system is supported both on smartphone as well as feature phone, whichever that the facility has. They are able to send the USSD code through SMS, as well as they're able to receive messages coming in from the service. So next, we are going to look at some of the use cases, which I think I've talked about. So one, the facility is able to query information about a patient transferring in or on transit. I've talked about that. There is advanced notification of the receiving facility about the patient transferring in. So in this case, you'll find that if a facility has transferred a patient out, then the facility that is supposed to receive this patient will receive notification that patient X is coming in on a particular date, depending on the appointment date that has been that the patient has been given. So they are able to wait and look forward for that patient, so that if in any case they don't see the patient, then there's supposed to be that feedback so that the patient can be traced or his whereabouts can be known where that patient is. And again, also, I've talked about the information to the mother facility about the client's successful transfer out when they reach on the other side, as well as the instant notification of mother facility about drug pickup from a facility, from a different facility. So as you'll be able to see when we are demonstrating this, you'll be able to see that if a walk-in patient comes to a facility to pick their drug, then the mother facility will be able to get that notification that your patient has picked a drug, this particular drug in this particular facility on such a date. So in that case, in that way, the mother facility is able to update their records accordingly, so that they don't classify this patient as not on treatment yet the patient has picked drugs. So that is a very important use case. So this is just a basic diagrammatic representation of the ART directory, how the providers are able to get information around the transfer out, about the transit clients, and also, most importantly, the silent transfers. They are now, the silent transfers will be a thing of the past if the facilities use this particular technology, because whichever facility that patient goes, the mother facility will have to know that your patient has come here. So then in that case, they'll be able to be, the mother facility will be able to update their records accordingly. So silent transfers will be resolved by the implementation of this technology. So if you look at it, you'll find that some of the features, some of the most important features in this application includes the initiation and acceptance of transfers. So a facility is able to initiate a transfer, and the receiving facility is also able to accept a transfer in. So then that kind of completes the loop, that transfer loop. And then I've talked about the transfer completion, when both facilities exchange feedback about that patient. And of course, the notification about the silent transfers, and also notification about the patients that are on transit. So again, when you use the code for the service is *365#. If you use this code and you are duly registered in the service, you'll be able to have a menu for the facility directory, the referral services, and also the generation of secret PIN. So you'll be able to get that as a main menu. And then if you dig deeper, if you look at the menu, you can still go to the sub-menus where you have the options for searching the MFL code, search by name, and update a facility. As much as updating a facility will also take place in real time through the OpenHIM. but then the feature is still available for you to update the facility information. Then for the referral, you'll be able to, you are able to initiate referral when you are maybe transferring a patient out. If you are a facility that is receiving this patient, then you are able to accept the referral. Again, also you are able to get patient details and also send out information about the transit client. Okay, and also there's the option of PIN generation so that you can securely access patient details, which you must accept for you to view the patient information. Yeah, so that is like a simplified menu for the service. So what does it mean for you as a facility, as a program? So there'll be one of the key value that you are going to derive from this application is the real-time electronic tracking of patient movement across facilities, including the ones on transit, as well as the ones on the silent transfers, as we have already, as I've already mentioned. A facility will also be able to accurately account for their TX card through identification and notification of silent transfers. Yeah, because much of the time, maybe if a patient just transfer themselves out, then there's high chances that their mother facility will report them as maybe lost to follow-up. They might not form the treatment cohort or the TX card for that facility. But with this application, they'll be able to know how to handle such cases. They'll be able to know how to account for their TX card numbers. Easy and accurate querying of patient ART information from an updated ART directory. That is also very key because for the walk-in clients, you'll be able to tell more about their treatment history from the original facility, as well as their regimen information. And again, also for transit patients, as I have explained, the facility will be able to now better manage the appointments through that notification of the transit patients, the patient that pick drugs elsewhere, and then they don't show up for the appointment. And this also not mentioning the other value about this saving the program, the resources that would otherwise be spent tracing the patient who has picked drugs elsewhere because they didn't inform their mother facility, or resources that is spent in tracing and tracking the patient that is on silent transfer. So that will be a save for the facility as well as for the program. Yeah, so those are some of the key value derivatives that you'll be able to get by using this particular application. So we'll transition slightly to this platform called the OpenHIM. So for the directory to be updated in real time, there has to be a mediating kind of middleware that is able to facilitate the exchange of information between Kenya EMR as well as these other applications. So this is where the OpenHIM is coming in. As Kevin will show us, progressively the OpenHIM will replace the IL that we've always used because it has got additional features, and also I think the ease of setting it up makes it more friendlier to use, and also it is packed with a lot of features that you'll be able to use to facilitate transfer of information between Kenya EMR and other clients. So for instance, you'll find that OpenHIM will be able to transfer information from Kenya EMR to Shauri, from Kenya EMR to ART directory, and any other that will come in future. So it will be a very easier way of information exchange between Kenya EMR and those other clients that I've mentioned, plus more. Okay, so how does it mediate? How does it work? So it kind of receives information from different information systems. In this case, it receives information from Kenya EMR and is able to coordinate interactions between that particular system, which is Kenya EMR, and the clients. Okay, and where the target or the receiving system, where the structure of the information doesn't match the expected structure, then OpenHIM is also able to transform a message along the way so that it suits the system that is receiving it. And setting it up is not very difficult, as you'll see. You just need to set up the client and the channel. Then you also set up, you configure the routes. Then does it, you'll be able to now start having the data exchange between those systems. Again, so this is kind of like a simplified diagram on where the OpenHIM comes in. So we have Kenya EMR sending out the registration and appointment messages to different clients, different recipients. For instance, Ushauri is expecting to receive registration details and appointment details for it to send out appointment messages to clients on the appointment dates. Also on the ART directory, it is sending that the information about the facilities, so that when you do a search in the ART directory, you're able to find the facility information plus the ART information of a particular client, including the transfer-ins and out. So in future, OpenHIM will be integrated with different plans, but for now we have Shauri and ART referral using this particular platform. Again, you'll also be able to check on the dashboard for the ART directory. You're able to log in through that link that has been provided there. When you get into that portal, you'll be able to perform functionalities around the searching for the ART facility contact information. You'll be able to search for clients and some observations, and you'll also be able to see some dashboards as well as line list as part of the reports. Okay. But for you to get into that, for you to use this particular service, there are some few requirements that you need to do or that you need to have. One, you need to be registered in the ART directory database. So for a facility to use this service, please ensure that your facility number is registered in the database so that you can start utilizing these services. Also, for the partners, ensure you can get registered by just contacting the Palladium point person. They'll be able to help you with the registration. But for the facilities, your partners will be able to register you into this particular service. It's very easy to register. It's just a couple of fields, and then you'll be able to be activated to use, your number will be activated to use that particular service. So the registration is done online on our website, on the ART directory portal, in the link that has been provided there. Yeah, and where you encounter challenges on this ART directory or any other HIS application, please don't hesitate to reach out to our service desk through those provided channels, the toll-free line, as well as the email. So then you can get sorted. So up to that point, I think I'll just give way for the practicals so that we can see the demonstration of ART directory, how it works, and what we are able to do with it. So I would like to invite Victor Were to take over from here. Thank you.
Thank you, Otieno. Confirm you're able to see my screen and hear me.
Yes, it is 4:50 on your phone. I'm able to see it.
Thanks. Thank you. So as Otieno has taken us through the features that are there for the ART directory /referral. So I'll just quickly take us through a demonstration of what we have so that you're able to see these features in play. So it's a USSD service that's accessible, and only the registered providers be able to access this. So the number, as Otieno has already shared, is 365#, and that is the USSD code that we use. So I know most of us have actually used that USSD service before. So we do this using banks. I know even as you check your credit on your phone, so that's a USSD service. Checking accessing your accounts, and various services have actually using this technology to allow for access by a wider group, because this one does not limit you to a smartphone, but you can actually use this with any phone that you have. A basic phone is basically able to access this. So the first step is actually registration, and Kevin will be able to share with us how that is done. So just going directly to what we have. So we have 3 services. So we have actually 2 services. We have the directory and the referral, and then we have the last is a secret PIN that is generated and used. I'll share with you where this is used, and it is a security feature that has been added to allow for an authentication, another layer of authentication in one of the services that you're able to access through this USSD platform. So once you dial 365, this is what you'll be able to see. Option 1 is facility directory. That's the directory, and then option 2 is the referral services. So we'll start with the referral services. So just go back and dial 365#. Let's start with the directory services. So for me to access directory services, you put in 1 and then send. And for directory services, we have 3 features. That is search by name, where you can be able to search the facility by name, search by MFL code, and last but not least, you are able to also update the details or the contact details for your facility. So let me just start with search by name. So if I want to search by name, then I can input a name, for example, Kenyatta. So we have a list of facilities. So we have Kenyatta National Hospital and Kenyatta University Dispensary that are there. If I just put in more, then I can be able to see the details. So once you search by name, then it gives you the list. So for us to, because of the issue of the names are widely shared, we encourage users to use the feature for search by MFL code number, because MFL code numbers have actually been used to uniquely identify the facilities, so that whenever, because sometimes some of the facilities are known using a local name, and that is not really an official name. And when you search in the MFL using that local name, you are not able to search to get this detail. So it's very important that we use, probably encourage the users to actually use the MFL code numbers to search for a facility contact. Going back 365, as I said, then you have the directory, then you have MFL code number. So I have various MFL code numbers that I can use. For example, if I want to search the contact details for Kenyatta, I know the Kenyatta MFL code number is 13023. So I hit send. It gives me the details and the contact details for Kenyatta. And you can see it's actually if Kenyatta had, of which Kenyatta has put in the different clinics. So we have CCC number and telephone number, PMTCT and TB. And if I put in more, 98 for more, I'm able to accept to receive these details in an SMS. So, and then a text message is sent to your phone with the contact details so that you can be able to use these contact details in an SMS. You can actually see this. So that's the use case that we have for the directory. Just going back to 365. Again, let me redo this. So I have a facility, a test facility that I can also use to 99999 as the MFL code. These are tests, MFL code for a test site. You can see it's given me a response that they have found this facility. It's called test facility 1, and that's the contact. I want to receive these details, send SMS details with details. I accept. Then an SMS is sent to my, I've just received another message. Here's the facility you found in your directory. Look at the last one, test facility, MFL code, and the CCC number, telephone number is there. So that's the use case for the director. Basically, to allow you to search the contact details for a facility. The other use case that we have is the instances where you find that the telephone number that is there is wrong, and you will like as a facility, or you have updated your facility. So we have option 3, which allows the facility. Remember, the users are mapped to a facility. So this basically allows the facility to update the telephone contacts. So I select which clinic that I want to update. I want to update the contact for CCC number.
Hello.
And the contact, my new contact is 7. Let me just pick a telephone number that can use. Just a moment. Just a moment. That. So I just want to start again. So 365. The directory. I want to update these details. So option 3 is to update. And I want to update the contact details for CCC. And my new contact detail 074084084. Sorry. 0840396. So those are my new contacts. Again, once you have updated this, a notification is sent to the facility or the person who has used, actually the person who has, and notifies you that, dear provider, you have updated your CCC clinic contact number from, this is what we had before, and the new contact that we will put in. So remember, this was the contact that we have. We have this, the number that I'm using is mapped to the MFL code, test 9999, the 5 nines. So I just want us to show that the contact has actually changed. So if I have, remember what I searched before? We had 07, so remember the results that I had before, which had, I think, 074 and zeros. So look at the new number is now the one that comes back. So let me just receive this in SMS. Yeah, SMS has come in. And so we have the message that I've received currently with the new updated contact details. So this, and what we had previously is 0724, which is up here. This is what we had before, and now we've been able to update the contact details to what we put in as our new telephone number for the CCC clinic. So those are the use cases for the directory. So going now to the next functionality, that is the referral. So for the referral, we have three aspects. So that's the third option. We have actually four aspects. So we have where the first option, which allows the facility to initiate a referral. Second option allows for receiving facility to accept a referral. These include reporting any silent transfer, anyone who walks into your facility and you did not receive a notification basically you didn't receive a notification for a referral, then you need to capture them as an accept facility, which now triggers a notification to the parent facility for that client that this client has actually come to facility X, so that we can be able to basically handle the silent transfers. The third option is to get patient details. So this one basically allows one to be able to search minimum data set of the clients, and basically you can use this to basically make a decision in terms of whether the type of drugs that this client receives, the type of their next TCA, be able to see their regimen, the current regimen, and the facility that they are in. And then the last one is the transit clients. So for transit clients, it basically allows the facility that this transit client has showed up in to be able to report that and report the number of days that they have issued the drugs to this client. And basically, it also allows for a notification to be sent to their parent facility that our client X has actually received their drugs in this facility, so that we don't have them reported as a defaulter or someone who an LFTU, yet this person has actually received their drugs in another facility. So those are the three options. So I'll start with option 3 to search patient details. And before you search patient details being a sensitive area, then we have you need to be able to generate a PIN that you use. This PIN is generated again through the system and is valid for 7 days. And it's tied to the person or the provider who is using the service. So let me start with option 3, that is to generate a PIN. So, and then I say accept. SMS, this should trigger an SMS that will come in with my PIN. So I have a PIN. You can see the details for this is, dear provider, your secret PIN is 3702. The PIN you require when accessing patient details can be know this PIN expires after 7 days. So after 7 days from today, then I'm not able to use this PIN. So going back to the use, So what I want to do, I have a CCC number of a client and I want to search the details for this client. And my CCC number, this is a test client, is 9999991. Send that. That's an invalid. I think it does not exist. Let me just want to. Then I'm supposed to provide the, which was 3702. There we are. So we have the information. So the client number is that. Treatment details, we have the regimen, we have the next TCA and the current viral load. So this information you're able to query and get this minimum data set. For example, if you, for instances, where you receive a transit client who really does not know the current regimen that they are receiving. So you can actually use this to query the system to be able to fetch some minimum data that you can be able to use to make a decision on which drugs you need to give the client. So this information also is sent in a text format. As you can see, the last SMS that we have received is of the dear provider client with UPN DDD 999 treatment details, regimen, and then the next TCA, and then the current or the VL. So these are test data that we put in for the sake of the demonstration. So going back to the other functionalities that we have for the referral. So the facility is able to initiate a referral, and you're only able to initiate a referral for the CCC number or the clients who are mapped to your facility. So you can't initiate a referral for a client whose parent facility is another facility other than yours. So for example, let me try to put in a random number. So you can see the or does not exist in your facility. The CCC number is invalid or does not exist in your facility. So let me have mapped the 999 CCC number to this facility that I'm using. Yeah, so you can see, so I have that. The next one is now I need to provide the receiving MFL code for the receiving facility. So I have another test facility that is 9. Okay. 9. So that's the MFL code. Then you need to enter the appointment date, the next TCA for this client. So for example, let me say this client is supposed to visit the facility on 20th of April. 20th of April 2023. Select the regimen. So probably this person receives ABC. So let me just select option 5. Yeah, so you can see a notification has been sent. The client with the CCC number has been successfully referred to test facility 2. Remember, we have 2 test facilities, so we have a facility 1 and facility 2. So again, a notification is sent to both sides. So the receiving and the contact details for the receiving and the contact details of the initiating facility. For this, the sake of this demonstration, so that I can be able to show you the SMSs or the messages that go out, I have put in the contact detail for test facility 1 and test facility 2 to be the same. As you can see, both messages have come to my phone so that I can be able to demonstrate the messages that have gone out. So we have this is the notification that the facility is able to receive that client with UPN this has successfully been referred from test facility 1. That's the message that goes out to the recipient or the receiving facility, and they also know or see the expected date of arrival, so that as they do their planning, they expect this person to show up at the facility by 20th of April 2023. So that's on the initiation of referral. So going to once that referral has been initiated, then on the 20th, or when the client shows up at the facility, then we expect the receiving facility to notify or accept the referral through this system by picking option 2, that is acceptance. And then on picking option 2, then they need to provide the CCC number. So let me just pick and to pick another CCC number that I have. Then you want to accept, you need to select your accepting. So it tells you has been referred from test facility 1 to from test facility 1, and a notification is also sent. You can see client with UPN has been successfully accepted at test facility 1. That is my facility, the one that I'm demoing. And a notification is also sent to the parent facility for this client to notify them that this client has actually been accepted to receive care. So this basically is also handles any silent transfer. People who show up at your facility and they are seeking services, and they say that we want to start receiving the services at this facility, so that we can be able to capture the silent transfers early enough. So the other option that we have, I think the last option that we have is for transit clients who just are passing by to collect their drugs. So we have option 4, that is transit client. So you pick transit clients, provide the CCC number. So let me just choose again the test. Provide the number of days that you have dispensed drugs to this client. So I say I've dispensed for 30 days. So, and then you get a notification that you have successfully recorded a transit details of client this. And notification is also sent out. As you can see, notification sent out that dear provider, your client with this has received a refill at test facility 1 to last them 30 days. So this notification is sent out to the parent facility just to be able to, so that they can be able to action on this and know that the client has actually received their services in another facility, so that they don't put them as defaulters, or it also gives them contact details of the facility that they receive these services, so that in case they need to seek any clarification, then the service provider is able to call this facility to seek any clarification. So I think basically that's it. Over to you, I think I'll now call, that's basically it. So we have the facility directory. I've gone through the referral and I've gone through how we are using the generation of a secret PIN. On facility, just to do a recap, we have gone through how you're able to search by name, search by MFL code, and update the contact details of this facility. Again, going back to the referral. For referral, I've gone through how you're able to initiate referral. As I've said, you can only initiate referral for clients who are mapped to your facility. I've also gone through accept referral. So for acceptance of referral, you're able to accept referral for silent transfer, people who show up at the facility and have said that, or they say that they want to start receiving services at that facility. You can also be able to accept referral for clients who have actually formally requested and you received a notification for a referral initiation from the parent facility in the system. As I've showed you, a notification is sent to the receiving facility once a referral has been initiated. The other option 3 is to get patient details. I've showed you how you're able to use the PIN to get minimum patient details that you can be able to use to make a decision at the facility. And last but not least, I've also showed you how you're able to record transit client details, and a notification is sent to the parent facility, notifying them that client X is currently or has currently received drugs for the number of days, so that they can be able to plan and know and action on this, so that they'll be able to know when to expect the client in their facility. Thank you very much. So I'll quickly invite my colleague Kevin to take us through the dashboard and just take us through the requirements for activation of a site to start using the services. Thank you. Over to you, Kevin.
Thank you, Victor. Allow me to share my screen. Okay. So, Victor, my screen is visible to you?
Yes, we are able to see the screen. Thank you.
Thank you. So, Baron Otieno had shared the link to this dashboard, the live link to this dashboard. For the training, I'll go through it in the test instance of this dashboard, because on the live link, then we have the live data that we not want to show in this training. So when you log into your dashboard, to the ART web using the link that Otieno had presented, you'll be able to see the landing page dashboard. And on your dashboard, you'll be able to see the number of patients that are currently in your ART web application. The providers, as we'll be seeing later on, are the people who can access the USSD code *365#. So we'll see how many they are. And if you've done any transfer ins, you'll be able to see the number, and any transfer outs, you'll also be able to see the quick numbers that are there. So that's what we have currently. We build on that as the use for the application grows. Then also on the ART web, what you can be quickly able to do is to access a patient list. So as I've said, this is test data that you can be able to see a line list of the same. And if you want to add a patient quickly to start utilizing the application, you can do the add patient feature. I'm just waiting for it to load. Or you can use the upload patient feature. So just a moment as it comes up. Okay, so there it is. So There are several ways you can add a patient to your ART web for them to be accessed via the USSD code. You can add them one by one. So the add patient feature allows you to capture a patient's information. So this is what we are currently capturing, minimal information about the patient's bio, the names, phone, date of birth, CC number, UPI, ART start date, and also for the observations, we are capturing the facility they are in, so you'll attach them to your specific facility, the date you are enrolled, viral load, their regimen, and their TCA. So that will allow you to capture a patient's record one by one. If you want to do it in bulk, there is the feature for uploading a patient list. So when you click on it, it will take you to a page for uploading a patient list. So as it's opening, where the patients are a bit many, we'll be able to click on a link for upload. And it will open a sample. Okay, here we are. It will open a page for you to click on upload CSV file in a selected format. So when you click on this sample CSV format, you should be able to download an Excel sheet, which I will quickly show. Let me just, so this is it. It will open this Excel sheet that you can quickly fill out the listing of your patients, their names, exactly what I've been able to show you on the screen. And once you are ready, you should be able to go to the other side and upload them. So that's how you quickly upload your patients. The other way I'll be able to explain when I'm doing the explanation on the OpenHIM side. So once again, I'll say this is the test server. As you can see from the link, it is the test server. The information you're showing is not of real patients, but of test patients. Then you can do a quick addition of providers, like you can see. And again, you have an opportunity to add patient, providers one by one. For provider, we need minimal information again, nothing much about them, just their names, their phone number. Phone number is important because of the USSD. That's how you're verified whether you can use the USSD or not. And also attaching them to your workstation. So if you have more than one provider, you can always add one by one. And again, for this option, you do have the option for uploading a list, which then avails you the opportunity to upload providers in bulk. So that's what you can do with the ART web platform for quickly managing your patients and your providers list. So I'll move on to the other feature for the, sorry, I'm flipping through, just got a bit distracted, which is the patient details. So for the patient details, you can search for a patient using their CCC number. And once you have their CCC number or their name, you can click on search, and then you'll find exactly the feature that was shown by Victor in the ART. You'll be able to see a listing of patients or clients who fit the search criteria, either their name or CCC number. For me, I entered the CCC number, so I got one, John Doe. And when I click on view details, I'll be able to see their information. So their name, the CCC number, the date of birth, and the minimal information that we are tracking. In our case, we can see the observation, the current VL, which is missing for this test client, the regimen, the TCA, and where they are currently at. If there are any referrals, again, it will be able to see it in the next tab and be able to see their movement through the facilities that they are. So finally, on the web, you can do some quick administration if you're at the level where you can add users. So users are the people who can be able to access your portal. So if you have been given the role of adding users, this is where you'll be able to quickly add them. For reports, right now we have minimal reports. We only have a line list for referrals. So you'll be able to get a listing of your transfer ins and outs and when they happen. So that's what we currently have for you on the ERT web, a means for you to maintain your patients, upload new patients and providers, and also to be able to quickly check on a patient details on the web instead of using the USSD. So I'll go to my next presentation, which will introduce the OpenHIM and see how currently we are able to get to you, for you, your patient's information into the application for you to start using and referencing them using the USSD. So we have the OpenHIM application that we've deployed to assist us in exactly the way the IL has been assisting us in terms of sharing the information across the eHealth and right now the mHealth applications. The need came about because, as you've seen, the number of applications are growing that will need access to the EMR information. So usually, previously we were sending only to the Ushauri, but now we needed to send information also to the ERT web and any other mHealth information system that will start using that information. So OpenHIM is assisting us to exchange that data efficiently and effectively. This dashboard can show you how we can be able to track and see the transactions that are going. Like this one is for transaction load per hour, just monitoring and seeing how information we've been able to share during the day, response times, and see where there are bottlenecks and if there are any, and also transaction status. For the different messages, you can see a majority of them were successful. There were no failures, and some are completed with some information you can check. As Otieno had alluded to set it up in terms of using the ART, the OpenHIM is fairly straightforward once you've deployed it in your server. So right now we are doing it centrally. You will not have to interact with it at the moment. In future, there might be a use case for you, but at the moment it's been deployed centrally. So all you have to do is to point your embedded Ushauri IL module to point to our OpenHIM instance, and all the information will arrive to your Ushauri and also to your ART web. To do that, we had to set up some channels, and through the channels is now where we are able to direct the information coming from your Kenya EMR to the specific applications. So if we could go into the production channel, we can see that definitely gave it a name, and we defined it as a post channel. So for those who understand, you can be able to send information directly there. And from the channel, we're able to define the systems that will be receiving this information. So we have two of them at the moment. We have Ushauri and we have ART web. So that's as much as you need to know in terms of setting it up. So once you have a channel, you can quickly add the systems that you need to receive the specific message that you want. So we have defined the messages here and where they can be sent. Then to quickly see how the messages are flowing, there is a transaction log that then shows you the flow of information as it's coming in. So you can see the ones that are successful, you can see the ones that have a bit of issues, which you can go in and check what the issues are. And if there were any failures, they'll also be able to go in and check. So if you go into this success, you can be able to see that this was an appointment message that has been shared, and also a success has been received on the other end. And when you scroll down, you'll be able to see that it has been successfully also delivered to the other two systems. So this is the new way we want to be exchanging information between the eHealth and mHealth applications, and also for any new use case that might come up in future. So at that point, I'd just like to end it there and then hand it back to Otieno to guide us as we move forward. Thank you.
Thanks, Kevin. I think I'll pass it to Songok to take us to the next session.
Yeah, thank you. Thank you very much, Leonard Otieno, for taking us through the slide deck. I guess basically in that presentation, there's some few take-home messages. The fact that ART directly is coming in to sort out a few of the issues that we've been facing in as far as keeping track of our clients. So we are able to tell where our clients are at any one given time and be able to accurately account for our TX card. So for me, this is more like a game changer in as far as keeping track and managing our clients is concerned. So, and thanks to Victor Were and Kevin Lanya for taking us through the demo, just tying the notes between what the intro that Leonard Otieno had taken us through. How then practically will we be able to ensure that these solutions help us in as far as managing clients using the various solutions that we've been able to develop. Right. So I think very quickly for my end, I want to just open up for any questions. Like I'd said earlier on, let's make use of the chat box. So that's the questions that have been asked, and most of them, if not all, have been responded to. Like one of the questions that one of the participants had asked earlier was, is using the USSD code free? And I think the answer is no, it's not really free. There's some small fee that will be charged to that effect. And the other question is whether it's already up and running. Yes, the answer is yes. We are currently using it. Then can more than 2 persons use one secret PIN? The answer is no. Each and every service provider will be able to use their unique code. So basically, sharing the codes or the PIN codes may not really be very possible because of issues around security of data and all that stuff. All right. So there was a question. And this has also been responded to. So we don't have, okay, like for instance, the participant was asking when we don't have a current VL date, how current is it? For instance, if it's not most current, then how current is it? And it was tied to another question from one of the participants who asked, when looking for the client details using that process, is it possible you add the date of last VL? And I think this is something that can be explored. It's not yet happening yet, but I think based on the responses, it's something that we can always look at, and so many other questions that Victor, Kevin, and Otieno have been able to respond to. So I don't know whether there is any that I haven't really gone through all of them, but I can see from the chat that Kevin has responded to a question asked by Winnie. Victor has responded to the question that was asked by Jessica. And thanks so much for being around to just be able to answer some of those questions that were raised. So I want to quickly just look out for any hand, just in case you have any any question that you want to ask. Just give me a second. Winfred, your hand has been up for the longest time. I saw your issue that you raised on the chat. I'm hoping that you got sorted because the presenters have been clear all through. So probably maybe you needed to just quickly check on your network, but I'm not certain whether you probably have a question that you want to ask. So if you have a question, kindly go ahead and unmute. I've given you the mic if you have a question. Meanwhile, let me just look at the chat again just in case there are any pending questions. Quickly, sorry. Right, yes, Wilfred, go ahead.
Okay, my concern was with the presentation with Otieno.
Yeah.
Actually, I was not able to see the screen, almost like the whole presentation. I was not able to see the screen, what was being presented, but I would hear the audio.
Apologies for that. I guess probably maybe it was an issue with your network because the rest of us were able to follow, but we apologize for that inconvenience. Hopefully you'll be able to access the YouTube channel. You can always play through and listen to his presentation, and you'll be able to pick up anything that you may have missed during his presentation. But apologies for that. Thank you. All right, so you can mute. All right, so Victor, there's a question from Lois. Who's asking, are we using the NUPI account? I really don't understand the context of that question. Then there was also a question from I think was it Kevin, whether we'll still need to use the what do you call it, the transfer letters as we always do with the introduction of the ART directory. So you could quickly respond to this, either Victor or Kevin.
So let me. I can take one question in terms of the NUPI. Currently, the system actually supports search by the CCC number. So we're using a CCC number. Yes, we have the NUPI details, but we are using CCC number to identify the clients. I think in the future release, we'll be able to consider to have both options for a CCC number and a NUPI number. The other question on whether you still have to use the transfer letters, I think probably the Songok and the NASCO team can guide on this, but I believe as we start off the system, yes, I think it still use the transfer letter to supplement, but at the same time, especially for the silent transfers who really don't come with a letter, you're able also to pick them up. So my advice would be, we can still go on using the transfer letter as we scale up the system. Thank you.
Yeah, thank you. Thank you, Victor, for your response, and I totally agree with you. As we start scaling, as we start using this particular resource, we may request that we still have some bit of documentation because there could be some details that may be required by the receiving facility. So it will still be nice to just maintain that. But moving forward, once we have scaled up to the ART directory and it's working seamlessly, then we may probably explore the options of dropping the transfer later, and probably based on whatever information that we will get, we will be able to improve the movement of our clients from one facility to the other. So for now, I think Victor, you've put it correctly. We may kindly request that we still maintain the transfer letters. For the silent transfers, there's really nothing much we can do with that, because I mean, it's a choice that has been made by the client. But from the receiving facility, I think what we may need to do is to just request them to also seek for official transfers from wherever they came from, depending on, of course, other dynamics within our facility. So thank you very much. I don't know whether there's any other question. I'm not seeing any question. I don't know whether there's any hand up. So let me just see. Yeah, I'm also not seeing any hand up. So that means we do not have any questions, we are good with the demos and the presentation. And at this point, we are about 19 minutes to the top of the hour. Then I think we can close as we come to the end of our meeting. So for me, I think I want to appreciate all of you for finding time to attend our third series of the presentation. Kindly note that our next session is next week on Tuesday. Then we'll have another one on 30th. That is on Thursday, and then the final one will be on 3rd April. That will be Tuesday, then next week, part 1. So kindly, again, let's just mobilize our colleagues to join so that they can benefit from this training. Let me just quickly go back to the chat so you can see some questions, because I don't want to still have some time, so I don't want to just leave anyone out. So Kevin Machar